Our colleagues can all relate to this for these dogs that may have recurrent UTIs, clients who call for refills and don't want to come in.
Yeah.
What's your sage wisdom for communicating to clients?
Well, I think we have to remember Gertie, and if we are not communicating the potential harms of antimicrobial therapy, especially indiscriminate use, then we're probably not being fair to that patient, and it's really hard when you have an owner that's pushing back and they just want the pill, the magic pill that's going to make it go away. So it takes time. And I think the other really important thing is communicating, not that you're withholding something from them, but a positive action. So, wow, I'm really surprised that she is having problems again so soon. And I really care about your dog. And so I want to make sure that we're not missing something really important. If I prescribe an antibiotic right now, I might be missing something, and your dog is going to get sicker. And so let's prevent that, and let's just have you come back in right away. So that's off the top of my head. These conversations can be a little bit more lengthy, but I think it's just really important to communicate to the owner that you're on the same page as them. You want their pet to be comfortable as soon as possible, just like they do. But you really do need to advocate for the pet and make sure that you're not missing something important. And it could be something really simple, like it just needs to be on a different antimicrobial. But if you don't do the testing to make sure, then you might be missing the boat, right? And then there are situations I recognize, I'm working in a referral center. So a lot of times people come in and they want to do the additional workup, but that doesn't always happen, even for specialists. And so there may be situations where you just can't. You can't do the culture. You can't do the radiograph. That's the place where if you have a little clinic ultrasound and you can take a second to pop a probe on the bladder to look for stones, it would be helpful. Or if you have a situation where you've treated the patient with 3 to 5 days of amoxicillin, try the TMS, with the agreement that if it doesn't improve, the owner really does have to come back in for more workup, because otherwise you are likely going to end up in a situation where you have, limited options to treat their pet. So don't just keep prescribing more, different, and longer if they're having recurrent infections. But the one exception is if they're really strapped, try the TMS. A lot of times we have susceptibility to TMS when we don't to other things.